So the Philadelphia Department of Prisons around 2008, early 2009, implemented a self-implementation of a 4-hour intake process. In that time, we were averaging about 200 inmates on a given day. 200 folks is a lot of folks to move through a receiving room at any given time. You don't know what you're dealing with, what the underlying health conditions are, or the ingestion of illegal substances. Because if you have someone coming off the street, we have limited history, and we want to do a thorough assessment to see what are the emergent needs, and it is to preserve life ultimately.
The Philadelphia Department of Prisons 4-hour intake serves as a national model for America's jails, faced with the daunting task of responding to the myriad and varied critical physical and mental needs of entering detainees, many withdrawing from street and prescription drugs and alcohol in lethal combinations, and many at high risk for suicide, exacerbated by drug withdrawal. That is what this video was initially filmed to showcase. However, since filming, an even greater challenge has fallen on jails, COVID-19, requiring immediate screening not only for the protection and care of entering persons, but the entire population of incarcerated persons and all persons working at these facilities, including correctional officers, medical personnel, and anyone else who may enter the correctional facility. Not surprisingly, the Philadelphia Department of Prisons has been able to embed new COVID-19 screening procedures and policies to respond to this new challenge within its existing 4-hour intake and screening program. As a result, the following segment will utilize video filmed before the rise of COVID-19 to illustrate the intake and screening process, which remains unchanged, but will insert what has been added or changed for COVID-19 intakes. For example, the video captures a detainee being interviewed before COVID-19. On the right, a new cut shows what that now looks like during the current epidemic. Experts suggest that if jails fail to identify and respond to infected persons, the number of expected deaths both within institutions and after persons are released to the community may double the projected number of COVID-19 deaths across the nation.
The intake process includes that when a person arrives here, they're evaluated immediately by security using a series of a few questions related to medical care. If a person is injured, if a person is suicidal, if a person's bleeding, they will get bumped up to be seen by medical immediately.
At the Sally Port, if an entering person indicates they have been exposed to COVID-19 or been around someone else who is infected, they are immediately separated from others and medical evaluates the person immediately. Thanks to advanced testing equipment, if the entering person has any symptoms of COVID-19 or is asymptomatic but reports being infected, they are immediately tested for the virus. The test is ordered by a physician or nurse practitioner, and then the medical staff perform the test. All COVID-19 positive cases require isolation for 14 days.
Even if they're not bumped up, we have to complete our evaluations at intake within 4 hours after the person gets off whatever vehicle brought them to the facility. That evaluation is a series of questions administered by a registered nurse using our electronic medical record.
We ask questions about mental health history, and their dental history. Based off how they answer those questions, our clinical rule engine, it will trigger the system to schedule appointments.
New intake questions have been embedded in the medical intake screening instrument. These include questions if the person has traveled overseas within 14 days or had close contact with anyone under investigation for COVID-19. Does the person have a fever? Any noted lower respiratory symptoms? Cough, shortness of breath, shaking with chills, muscle pain, headache, sore throat, and loss of taste or smell?
So then we have an additional form where there's questions on their parents. So despite them not willingly telling us initially, there's still signs that they can be exhibiting that we can see as nurses.
That's the time that we really use that 4-hour window to identify who's here, what are the needs, and getting them moved along in a continuum of treatment, all while being held in the custody of the department on a criminal matter.
Philadelphia jails have also instituted procedures to protect correctional workers. All employees, visitors, police, and others are also screened for infection or exposure every time they enter a jail facility. Employees' temperatures are checked, and employees conducting the tests wear masks, gloves, gowns, and eye protection. Temperature is checked with non-contact thermal thermometers where appropriate. If temperatures are confirmed to be 100 degrees Fahrenheit, employees are taken to a security supervisor. Inmate intake staff wear gloves, and those in close contact with suspected infected persons wear full personal protective gear. Staff in the quarantine are also equipped with all protective gear: face shield, gloves, surgical mask, and gown. Any staff, including transportation staff with direct contact or offering medical care to confirmed infected patients, wear all protective gear and respirators, preferably N95 masks if available, otherwise surgical masks. Inmates working in laundry or food preparation wear gloves and gowns, as do inmates cleaning areas where an infected patient was housed.
So with all programs, when you start, you'll have some bumps, some hurdles that you have to overcome. But whenever you initiate any program, you need to think about the benefits, the pros, the cons of all things here. Sure, we have some bumps in the road, and we'll probably have even more bumps in the future. But we have to look at the whole picture and see how beneficial it is to our inmate population. Is this beneficial to us? Because we're saving lives. Potentially we're saving lives, and that's what it's about.
This is a copy of your discharge instructions. I'm going to give you 15 Suboxone to take with you. You take one a day. You have an appointment with the Wedge tomorrow. Here's a list of all the clinics and their hours of operation.
Although this video has focused on the Philadelphia Department of Prisons' exemplary intake, screening, and assessment program as it relates to COVID-19, the department also strives to prepare persons for their safe re-entry back into the community. Those leaving are provided with Department of Public Health guidelines on how to protect themselves from infection. For the many who have been provided medication-assisted treatment for opioid use disorder, another epidemic the jail continues to address, ample medication is provided to tide them over until they can fill prescriptions in the community. While the jail makes post-release appointments for those they know will be released at a specific date, for all others, they make electronic referrals to community MAT providers, already selected by persons at intake when they are inducted into the jail's robust MAT program. The jail sends a full-fledged medical discharge summary to that provider. The fact that the Philadelphia Department of Prisons has been able to successfully incorporate COVID-19 screening and implement policies and programs to safeguard its staff and detainee and sentenced populations speaks to the critical importance for jails to implement similar intake and screening protocols and programs to meet current exigencies and those that may arise in the future.